encourage Michigan to spread the virus. As measures were implemented and evidence grew, Michigan infection decreased to 5 and then 2 and 0.8. April, person with COVID-19 of less than 1 person, allowed curve and rate of life. This shows the data case and about 0.7 times higher than what we actually had here. Without intervention, Michigan experienced 58,000 positives before first. The home state or denied lives. The data shows that very few states dropped their infection rate as low as Michigan. And this is just, if you can go on, this is just a comparison with our peer states here in the Midwest. In the next slide, you can see how Michigan stacks up to other states that opened up quickly and didn't take the aggressive actions we took. And this map shows that only Michigan and New York are currently on track to contain COVID-19. Now, this is good news. But like you've heard me say many times in the past, and you will hear me say it many times in the future, it is still important to note that this is a novel virus and there is no cure or vaccine for it yet. So we have to continue to stay vigilant, and we've got to be flexible in order to lower the chance of a second wave and mitigate how serious that second wave is. Now, we have seen what's happened when people don't take this seriously. We see exponential growth happening again. We've seen people come from out of state, Michigan, and bring COVID-19 with them. We've had 2 situations where people came from out of state, one in the Traverse City area over Memorial Day, and another in Midland after the flooding event. We saw someone come in from out of state to help, and they brought COVID-19 with them. So what we want to avoid desperately is to Michigan to emulate what is happening in other states, where people have dropped their guard, where people have re-engaged in an unsafe manner, and where they see positive cases ramping back up. We are seeing spikes across the country, Texas and Arizona and more, the Carolinas. But because the vast majority of Michiganders are doing the right thing by staying home and staying safe and staying informed, we're not yet seeing another spike here, and that is good for everyone and for our economy. We owe it to the heroes on the front lines to keep doing our part and taking this seriously. Masks should not be political. They are designed to save our lives. Please wear your mask when you're in public and continue to practice social distancing. Wearing a mask dramatically lowers the possibility of transmission. This was something that I think is helpful in depicting what it means to wear a mask. When you wear a mask, you're protecting others. And you can see 2 people wearing a mask cuts the possibility of transmission to 1.5%, whereas one person who's carrying COVID-19 and is asymptomatic has a 70% chance of infecting someone else who is even wearing a mask. So mask wearing can't be partisan, it can't be political. It is a practical way to make sure that we continue to lead this nation. A new study has shown that 80% of Americans, if 80% of Americans wear masks, COVID-19 infections would plummet. So let's stay smart and stay vigilant and stay in the lead. Here's an example of what not to do. Don't go out and cram into a place of accommodation that was previously closed. And if you are going out, use the best practices to keep yourself and others safe. Now, I'll continue to work with the Michigan Economic Recovery Council to make sure that we stay disciplined and show the world what Michigan is capable of. One of the number 1 questions that I have gotten since we had to take our kids out of school is whether or not they will return to school this fall. And I completely understand, as the mom of a daughter who is supposed to be starting her senior year, or who will be starting her senior year this fall, and another who will be starting her freshman year at the University of Michigan. I know how important it is for students and their families and educators to make sure that we get this right. With the entire state of Michigan in phase 4 of the My Safe Start plan, We are optimistic that schools will be able to conduct in-person instruction while also complying with strict safety measures. On June 3rd, I announced the appointments to the Return to Learn Advisory Council, a group of 25 experts that includes educators, parents, and students. This council, which is chaired by Tanya Allen, was created to identify the critical issues that must be addressed, to provide valuable input to inform the process of returning to school, and to ensure a smooth and safe transition back to school. The group is currently working on a return to school plan that will closely align with the My Safe Start plan. As always, public health data will inform our decisions about opening and closing school buildings. Minimally, we'll be using the 8 MERC regions when deciding which phase we are in. However, we are working closely with local public health officials and epidemiologists to determine if the data will be reliable enough to allow us to make a more granular approach and with schools and be able to make determinations on the county level. For example, there could be a situation in Region 8 if there's evidence of a spike in cases or significant community spread in Chippewa County. Perhaps Chippewa could shift down and not the whole region, and that way Houghton schools could continue. We will see, but that is one example of how this might work. Schools may be able to resume face-to-face instruction in Phase 4 if they implement strict health and safety protocols. Our hope is to release an executive order and a robust document that we're calling Michigan's Return to School Roadmap on June 30th. That will provide details on what will be required and what will be recommended for our schools. Districts, students, staff, and families must be nimble, and we've got to be prepared to move backwards if there is evidence of community spread of the virus. While we hope soon to be in Phase 5 and stay there until post-pandemic, we've got to be prepared for spikes that might occur over the next school year. Public health conditions change daily, and we're going to need to be prepared to move quickly between scenarios. So the roadmap will set minimum health and safety requirements, although districts may choose to enact more aggressive ones in consultation with their local public health officials. These minimum requirements will apply to all schools, traditional, charter, public, private, and parochial. We recognize that protocols will cost money, and that's why preserving every dollar possible for K-12 is my number one priority. Nothing's more important than the safety of our kids and school staff, and we know that nothing can replace the value of face-to-face instruction. While budget decisions are evolving, there's no doubt that we will need more support and flexibility from the federal government. This is a crisis unlike anything we've ever seen in our lifetime, and it has had significant budget implications, not just for Michigan, but for states all across the country. We need the federal government to provide more funding for states and flexibility so we can continue to provide crucial services. And we need their help to ensure resources for our kids. Over the past week, Michigan has emerged in a national leader in COVID-19 mitigation, thanks to the people who did their part, and especially the brave men and women on the front lines, and thanks to our epidemiologists and experts in public health. But let's be clear, this crisis is not over. COVID-19 is still very present in Michigan, and if we drop our guard, we'll end up on the map the way that those other states are. So we've got to stay disciplined. Let's maintain this lead for the sake of our health and for our economy as well. We must do our part by wearing masks and practicing social distancing. And I'm hopeful that we'll be able to move the state into Phase 5 of the My Safe Start plan before July 4th. It's going to take everyone's continued efforts to get it done, though. So I'm proud of the work that we've done. We've been able to do this because of quick, aggressive action that we took. The data shows our actions working, and yet we still see attempts to take away my authority to take these actions, which made it all possible in the first place. I want to be very clear. Any attempt to strip away the powers of the governor during this crisis is irresponsible, dangerous, and foolish. We're here today in Phase 4 of the My Safe Start plan, heading towards Phase 5 and leading the country because of the action we took. Millions of Michiganders who've done their part as well. Let's keep up the good work. Let's stay safe Let's be smart and remember to wear your mask. I want to end by saying that this Friday is Juneteenth. On Wednesday, I issued a proclamation declaring June 19th as Juneteenth Celebration Day in Michigan. Juneteenth is a crucial day in our nation's history, to remember how far we have come and to recognize how far we still have to go. During a time when communities of color are disproportionately impacted by COVID-19, and when the deaths of George Floyd, Breonna Taylor, Ahmaud Arbery have shone a light on the systemic racism Black Americans face every day, we must work together to build a more equitable and just Michigan and a more equitable and just United States. We've made progress since the start of this administration on criminal justice reform and addressing racial disparities in education, healthcare, and more. But there is more work to do. I promise to continue working toward a more equitable Michigan. And I know leaders in this administration, across this administration, share that goal. Leaders including Dr. Janae Caldoun, who is here today to share an update on COVID-19. Thank you.
Thank you, Governor. So as of yesterday, Michigan has 60,189 confirmed cases of COVID-19 and 5,790 deaths. Overall indicators for the state are trending in the right direction, with much of the state remaining in the medium or low risk range. Every MERC, except for the Kalamazoo region, has under 20 new cases per million residents per day. The Kalamazoo region is at about 22 cases per million people per day and has seen a recent increase in the past couple of weeks. But we know that the local health department serving Branch County is working very hard to expand testing and contain an outbreak that's particularly associated with a pepper farm. Testing across the state has also held steady at a little over 14,000 tests per day, and the percent of tests that are positive continues to drop overall and is now at about 2.2%. That is about half of the rate of positivity that it was last week, which is a good sign. We also know that people are continuing to recover from COVID-19. Last Friday, 44,164 people died 30 days after their diagnosis, which is also a good sign. We continue to emphasize that the best way we can know where disease is in the state to stop the spread is to make sure that anyone who needs a test can get one. We are working hard to expand testing, particularly as we re-engage more sectors of the economy. So if you feel sick, you should get tested. If someone close to you is sick or has symptoms, you should get tested. Work outside of the home, you should absolutely get tested. There's dozens of test sites across the state, and they're offering testing at no cost to the patient, including people without symptoms. So we're asking that employers, community groups, and local leaders work collaboratively with these sites to maximize the use of testing capacity in the state. And remember that a doctor's order is no longer needed to get a test done. So you can find a list of our testing sites across the state at www.michigan.gov/coronavirus test. You can also call our COVID-19 hotline, and that number is 888-535-6136, and they can help you find a place to get a test. We also know that we have to do everything we can to protect our most vulnerable, and particularly those living in nursing facilities. We've already set up regional hubs. So those are facilities that were verified to have appropriate staff, space, and PPE like masks and gowns to be able to take care of nursing home safely. We've set up comprehensive infection prevention, resource, and assessment teams that have worked with nearly 300 long-term care facilities to make sure they are following best practices when it comes to preventing spread of COVID-19 in their facilities. And we've been working very closely with the National Guard to make sure testing kits are available to nursing homes across the state. But earlier this week, we took it even further. The Michigan Department of Health and Human Services announced a new order on Monday mandating that nursing residents and their staff. All facilities now have to, on an ongoing basis, test all residents when they are being admitted to the facility and test all staff or residents who have symptoms or have been exposed to someone with COVID-19. And Any facility in a region of the state with a higher number of cases has to test both residents and staff every week until that facility has gone at least 2 weeks without any new cases. This will make sure we are quickly identifying anyone who could have COVID-19 and that we are preventing it. We also know that it's important that we accurately report nursing home case and death data. So over the past 2 weeks, we've had a team of dozens of people with staff from the Michigan Department of Health and Human Services and Michigan State University and others who have reached out to every nursing home in the state to make sure the data that they were sharing with us was accurate. We've now posted this validated data of COVID-19 cases, deaths by facility on our website. As of June 16th, there were 7,163 cases of COVID-19 and 1,947 due to COVID-19 in nursing home facilities across the state. That is 12% of our state's cases and approximately 34% of the state's deaths. This is not something that we take lightly at all, and I myself have had who contracted COVID-19 in a nursing home in another state. So it is incredibly important to us that we continue to work hard to protect people living in these facilities. As the governor mentioned, Michigan's fight against COVID-19 is nowhere near over. Do not think that just because we're seeing a decline in cases that the risk has gone away. All it takes is a couple of people with the disease who can spread it to several others, and we will see another rise in cases. We are still seeing cases in the state. And we know that other states where people have let their guard down, as the governor mentioned, they are seeing spikes in cases. Everyone has to keep being safe. Wear your mask when you're out. Don't wear it down around your neck. Don't wear it only over your mouth, but wear it properly over your mouth and your nose. Wear it every time you're going to be in a public place or not able to remain 6 feet apart from other people. Wash your hands diligently with soap and water. Use a hand sanitizer and clean frequently touched surfaces like doorknobs and computer keyboards or light switches often. And by all means, please stay home if you are not feeling well and you are sick. It's been a long and past few months here in Michigan, but please everyone remain patient and vigilant as we continue to fight COVID-19. And now I'll pass it over to Tanya Allen.
Thank you, Governor Whitmer and Dr. Caldoun. So good morning to everyone. My name is Tanya Allen, and I stand before you with multiple hats. And so the first is that I'm a mother of 3 children, of which one is a rising 9th grader. I'm also the president of the Skillman Foundation, a Detroit-based philanthropy where we work to ensure that all children in our city are able to learn and to lead. And I also stand here of the Governor Whitmer's Return to School Advisory Council. After nearly 1,800 submissions, 25 talented and thoughtful citizens with cross-sectoral representation in the fields of education, public health, government, and nonprofit were selected to serve our state on the Return to School Council. These advisors really represent students, parents, teachers, administrators, school board members, organized labor, doctors, public health executives, mental health professionals, and policymakers. So we have a broad spectrum of experiences and knowledge that will benefit our state and the recommendations that we will present in the roadmap. And our membership is committed, talented, and we're extremely anxious. We want to do right by our state. We understand the implications of returning to school and that it will have an outsized impact on our health as a state, our educational system, as well as our economy. They be both thoughtful and sensible. So as the chair and the representative of the whole, I'm very mindful that the decisions of this body is privileged work. And with any great privilege, there is great responsibility. Protecting our children, protecting our educators, listening to our parents, bringing forward recommendations, context, as well as aspiration, ensuring that we preserve for all children in our state to experience a high-quality education experience during this pandemic. And that means that we have to think about how all of our recommendations affect different geographies, different subpopulations of children. Children who live in rural communities, children who live in cities, children with special needs, children who are new to learning English, children whose parents may not be equipped to teach them at home. And that protection system, both academically and financially, and pivots us forward versus losing a decade of growth and development, which we witnessed in our state after the Great. People across the state have done their part to slow the spread of the virus and to flatten the curve, as Governor Whitmer and Dr. Caldoun have shared. And the state is moving forward with the governor's Michigan's plan. It's only since that the return to school council work be grounded and aligned with the governor's plan. And we must remain diligent so that we prevent another surge of COVID cases. So in closing, I want to share that if we stay diligent, this is what we can expect. We can expect that school will open in the fall, that there is going to be a group representing the return to school council taking these issues seriously, just as seriously as you would and any other parent would, that there will be guidelines, direction on how to ensure the safety of their students and their educators, and that you should have confidence in those guidelines, and that parents can be assured that their children will be cared for physically, academically, and mentally, and that we will all be navigating a new normal together. So we must be nimble and agile, because some things may need to change, especially as we're still amid the coronavirus pandemic. Lastly, and most importantly, Michigan can have a peace. Our kids, our children, our future will be safe and prepared to lead the state forward. Thank you. Sorry, Kat.
Thank you, Chairman, also to Governor Whitmer, to serve our in education in Michigan as a member of the Return to School Advisory Council. My name is Kevin Polson, Superintendent of Godfrey Lee Public Schools. Our council understands the significance of our work and the high interest for a safe return to school. As a representative of Michigan school leaders, our responsibility is the safety and well-being of those we serve. This includes our students and staff, as well as our parents and community members to support teaching and learning in our schools. Our council is committed to creating and return to school, but also sensible ones. Shifting in-person instruction to stage 4 with strict regulations is a common sense and best practice approach to reopening schools. Reopening schools is vital to fully restoring the economy in a manner that is to avoid the potentially devastating impact a false start could have on both our education and economic systems. Equity is a core value of the Advisory Council. Traditionally underserved populations, students, homeless, English learners, students of color, and students in poverty have been disproportionately impacted by the harms associated with COVID-19. Our council recognizes that our students who need the most resources to ensure an excellent and equitable adversely COVID-19. In addition, we know it will take additional resources to safely reopen schools. A successful plan for return to school requires financial stability of our districts to serve each student, including our most vulnerable populations. All this spring, drastically shift the way we provide teaching and learning to ensure we meet the needs of all learners through the continuity of learning plans. We know the plans from this spring aren't sustainable in the long term, and the uncertainty lies ahead of parents and the community. We hope the relationship and the road parents and the school community the reassurances and time in order to plan for fall. A wide spectrum of stakeholders are represented on the government advisory to ensure that future and the collective future of our state is at stake, and we must be ready to meet the challenge that awaits. Thank you.
Good morning. Alberg, and I am a high school teacher in Howell Public School. I'm honored and humbled to represent educators on the Return to Learning Advisory Council. I'm grateful that the governor intentionally includes the voice of classroom teachers in her decision-making. As a parent, I'm deeply appreciative of the opportunities to learn that school districts across Michigan created for students during the past months. As an educator, I know that we can and we must do better next year. Without question, the upcoming school year will be challenging, and we must be prepared to adjust so kids can experience the powerful learning opportunities they're entitled to, and we can stay safe and healthy. It is the Council's charge to help Governor Whitmer develop a plan that will enable students across Michigan to return to in-person learning. In order to make a return to learning possible, we'll need to not only to adapt and plan, but to work together in untested and unprecedented ways. Teachers and administrators will have to work more closely than ever before. School districts and the healthcare community will be required to build meaningful and powerful partnerships. School communities will have to work to support the academic, social, emotional, and health needs of both our students and our families. All learn together how to navigate this pandemic. And finally, the effort to return to in-person learning must begin now, and it must begin with all of us. It's important to be reminded that it was COVID-19 that closed our schools and schools around the globe. It continues to present risk in our communities and spread to new places. We must make health and safety our top priority in order to get back into our buildings and into our classrooms. We must be vigilant, we must wash our hands, we must wear face coverings to promote the well-being of our friends and our neighbors. Our actions today will impact the quality of the learning experience of over 1.5 million students in the fall. Thank you.
Great. Well, thank you for your work on the commission. I think it's incredibly important. You're doing a great job, and you get a lot to do in a short period of time, but we're awfully grateful. So with that, I'd be happy to open it up for some questions of me or anyone who spoke today. Dr. Calhoun, of course. So, yes, Jonathan.
Governor, you mentioned, as you put it, need for more financial assistance. Two-part question here. Will this school opening plan, whatever it looks like, be feasible without additional federal resources to help schools have the supplies needed? And B, the legislature today appears poised to finalize a supplemental spending bill that would spend a large chunk of the remaining CARES Act of the federal government. Are you on board with that plan?
Yes, so I'll answer your questions in reverse order. Yes, we have had, I think, fruitful negotiations, and I do believe that that's reflective of those negotiations. With regard to the bigger question of what is funding going to look like, I have had a number of conversations with people at the federal level who assure me that we are going to get the flexibility and we'll get some additional resources. Precisely what that looks like, we won't know until the U.S. Senate takes action and until the president signs it into law. I can tell you this, I have had conversations with my fellow governors across the country in our NGA calls, so Republican and Democratic alike. I have had conversation on this issue with Midwest governors that I convened. Specifically on our call last week was Governor DeWine of Ohio and Governor Holcomb of Indiana, as well as Governors Evers of Wisconsin and Walz of Minnesota. The other two weren't able to join us, but I can tell you every single one of us is confronting the same issues. And we are all hopeful and optimistic that we're going to get the support we need from the federal government. It is very difficult because we've put tax collections back to July 15th. We'd hoped to get budgets done by July 1st. We know that that's not going to be the case, but we are going to continue forging ahead on designing what is our kids are going to need as they return to school. We got to get this right. And I think one of the concerns that I have on top of making sure that they've got the wraparound supports is, as a mom, as a policymaker, I know that learning loss over the summer is real. And it is more dramatic for kids who are in high poverty situations. And so it's really important that we look at the summer, not just an extended summer break. This is going to have serious needs of our kids. They're going to have additional needs for wraparound services. And just in order to meet the health guidelines that we know are going to be necessary, bringing classes size down or creating protocols, open air as much as possible. Of course, it's Michigan, we'll get cold, but there are lots of pressure points that we are trying to navigate, and funding is but one of many. But I remain hopeful and somewhat confident that we're going to get support out of the federal government, because this is not a situation unique to Michigan.
Governor, I think the state of emergency is set to expire Friday. Will you be extending that?
Yes.
And do you think, will it go through July?
It will. Every state in the nation has some form of state of emergency that is ongoing. It's necessary to continue to have the other executive orders that we've had to execute to be, valid. And so we will remain in some form of a state of emergency. Early on, I know people were conflating state of emergency with stay home, stay safe. They're not the same thing, but being in this state is what gives us the ability to continue to protect people. And all 50 states are in some form or another of state of emergency because of that precise issue, and we'll have to be as well.
Yes. Governor, you've talked a lot about avoiding a second wave. Which which benchmark are you looking at where we can say, okay, we've avoided a second wave, we're finished, or we can loosen restrictions?
Well, you're not going to be surprised when I ask Dr. Caldoun to come to the microphone. I'll just say this. We know that states that have dropped their guard are going through a wave. Some would say it's their first wave because they didn't take it. Some states didn't take it as seriously as we did on the front end. They didn't have the kind of early issue with COVID-19 that Michigan had in New York and New Jersey and Connecticut. But they're now going through what is a crisis, and they've got hospitals that are full, and they're worried about PPE and all the things that we were worried about a couple months ago. The likelihood of additional spike, anyone who has studied what happened with the 1918 flu pandemic or what's happened in other nations around the world knows that that's a very real possibility. And the more we start to congregate indoors as the temperature goes down, in combination with flu season, we know that this is something we've got to be very concerned about. But with that, I'm going to hand it over to Dr. J so she can tell you a little bit more about what we'll be watching in terms of numbers.
So that's a great question. So I can say that until we have an effective antiviral or a vaccine that not just is available, but that it's being, but people are getting the vaccine broadly, we're going to have to live in kind of a different way across the state. So some of the metrics that we'll be looking at are some of the things that I talk about often. So number of cases per region. We'll be looking at whether those cases are associated with an outbreak or if it's more broad community spread. We'll be looking at obviously our deaths, but understanding that deaths tend to lag where the cases are, so they tend to be a little bit later. Of course, we'll be continuing to look at hospital capacity. We know that very early on, particularly in Southeast, a lot of our hospitals were struggling with maintaining staff and space to take care of not just patients with COVID-19, but patients who don't have COVID-19 as well. So those are some of the things that we'll be looking at. There's not going to be a special number that will say we definitely will move forward or move backwards. We'll look at it all in context and then be able to make the right decision as far as how we might continue to reopen the economy, or unfortunately and hopefully we don't have to do this, roll it back a little bit.
We'll take a few more questions, but can you speak up so the mic can pick up your questions? Yeah, thanks. Governor, the unemployment insurance agency is still having issues with people not getting paid. I know there were some scam issues, but Michigan is one of the worst in the United States, coming second only to Nevada. So what more can be done at this point?
Well, first, I'll challenge the characterization that we're one of the worst. That's not accurate. Michigan has actually met the needs of more people than just about any other state. We have a unique challenge here in that we've got more people that are in need. And that means while we have been able to help more people, we still have more people who haven't been met. And that's an issue. And I'm not going to get defensive about that. That's a problem that we are continuing to work on. I'll also acknowledge that we have, is a criminal component to people trying to defraud unemployment systems across the country. And we've started an investigation on that front. But because our unemployment rate has been so high, because we've been hit so hard by COVID-19, that is, a challenge that makes it harder for us to get to the last people. Now, we have quintupled our staff. We have done an incredible amount of work to meet people's needs. We've moved billions of dollars to help people. We have also are working with an unemployment insurance fraud task force that's being led up by the Attorney General to get accountability and try to recover as much resources as we can. So I would say that we have work to do, there's no question. And it's cold comfort to people who are still frustrated in getting through the process that we've helped a record number of people. And we will continue working until everyone who's eligible gets the resources for which they are eligible.
Governor, given what you said about attempts to take away your power, would you call publicly for the Republicans to drop their suit against you?
I think that in the midst of a global pandemic, it's really important that we refrain from letting public health become a political football. It's dangerous. Lives are lost when that happens. The fact that even wearing a mask has become a political statement is really unfortunate, and I'm hopeful that we can show the world that that doesn't have to be the case, and we're asking that people mask up for their own safety, for the safety of their family, and for the safety of their community. With regard to the politicization, I think it's dangerous, and for a governor, no governor in the country likes using these extraordinary powers inherent in the executive office. No governor in the country wants to be navigating through a global pandemic. No governor in the country relishes the actions that we've had to take. I've talked with a lot of my colleagues, and I know that to be true. And yet they're absolutely necessary that we have these powers for situations like this. If we hadn't taken the actions that we had, thousands more would have died in this state. And so for people to come in and to make it a political issue is really foolish and dangerous, I think. Whether it is position or whomever succeeds me ultimately, regardless of what party they're in, I hope they have the tools to do what they need to do to listen to the experts and keep me and my family safe. And that's precisely what's driven every decision that I've made as governor. Yes, Eric.
Now, you have repeatedly said that wearing masks is an obligation, it's an order. As people are opening back up, there are people out and about. Fewer people are wearing masks in certain situations. You showed a photo of a bar that was not social distancing. How much enforcement is there? Can you push this? I mean, it just seems like a major complaint.
So I think that the vast majority of business owners are really want to get this right. They're worried too. They're worried for their employees. They're worried for their patrons. I went out and had a bite to eat in Detroit last week with the mayor. We both wore masks. I wanted to check in with my council to make sure I did it precisely right. You wear your mask until you're seated, and then you can take it off and enjoy your meal and then put it back on. The wait staff all had masks. The owners had masks on. Everyone was masked up. We can resume some of these normal functions in life if we're about it. Now, if we're not, if businesses don't enforce this, their employees are going to be scared to come to work. Their patrons might get sick and might be afraid to come in and, patronize their businesses. And so it's on all of us to get this right. I think it's really important that businesses are empowered to set the example, that everyone who has a platform sets that example, regardless of whether it's local level, the state level, or the federal level, regardless of what party, that people recognize that this is something that we do to protect ourselves and our loved ones. I have a daughter who is asthmatic. I know that if I am asymptomatic and bring COVID-19 home, that she could be in, serious situation. That's why I want to wear the mask. I wear the mask because of all the people that I serve and represent. I want them to see me wearing it. I'm hopeful that others will embrace that. I know that my Republican colleagues in governor's offices are, by large part, doing the same thing. I think it's incumbent on all of us too. That pictorial that we showed about what the odds are of transmission. If two people are wearing a mask, it goes down to 1.5% according to data. If one person's wearing the mask, but the other one's the asymptomatic person that's carrying COVID-19, they have a 70% chance of getting COVID-19 even though they're wearing a mask, the healthy person on the receiving end. That's why this makes a difference. So if everyone wears masks, we can continue to show the world Michigan can get it right. We're disciplined, we're smart, and we're going to get back to business here. Mackenzie?
This may be a question for you and or Dr. Calhoun, but when we're starting to see more data coming out about nursing homes, but when can we expect to see the information about other long-term care facilities in the state?
Yep, I'm going to hand that over to Dr. J.
So we are actively working. Again, we basically built an army of people to call every nursing home individually to get the data and to get it right. And there's still even a few that we didn't get in contact with. So our next phase will be getting information about the other long-term care facilities. The challenge is some of those are not actually regulated by us, so it's more difficult to get the information and to get into those facilities. But again, being robust and getting more accurate data out is what we're going to continue to work to do.
Quick follow-up, do you plan on calling all of those facilities like you did with the nursing homes?
At this point, again, I'm not even sure how many there are, to be honest, because we don't regulate them, but we will do whatever we have to do. If it's making phone calls, we'll make those phone calls.
All right, we'll take a couple more.
Yes. The question, if we do get a second wave, what would you do differently to avoid the virus getting a foothold in nursing homes or long-term care facilities?
Well, I think a lot of the actions that we've taken will improve our odds at keeping people safe in congregate care facilities with older residents. We know that they have a unique vulnerability to COVID-19. We've seen it play out across the country. Sadly, it's been the experience in every state that's had COVID-19. We're in a stronger position because we've built up PPE, we've built up our testing capacity. We understand better the inherent risks, and so I do think that all of those things will help inform decisions as we move forward. But even as of yesterday, we've refined and I think been able to promulgate rules that will do improve safety. Yeah.
Governor, I know you said you would go more into detail on minimum requirements for schools later on this month, but do you, for teachers and students who are, might be even parents who are curious, what would some of those minimum requirements look like?
Tanya, you want to take this? She's very excited. No. Well, I think it's hard to tell precisely what it's going to look like. They're doing an incredible amount of work. I mean, we've got 25 people across the state. We had, over 1,000 apply to be a part of this. I know people really care. They want to get it right, and they're working very closely with our public health experts to do that. What could it look like? I mean, there are a lot of things we could imagine, but we also have to remember we've got over 800 school districts in the state of Michigan. Each has unique challenges and each has unique resources, whether it's what the building looks like. And so I think what I can tell you is that our intent is to resume in-person instruction, to do so in a way that is safe, but also to make sure that as we get back to school, as we return to learn, that we have very clear guidance to what the minimum expectations are. Some schools will be able to do things even in an even more aggressive way. Others will need some help just to get to the minimum expectations, but bringing down class size we know is a possibility. I think one of the statistics that I shared with the national experts with whom I was on the phone this weekend, Sheesh Jha and Zeke Emanuel, Scott Gottlieb, Josh Sharfstein. These are people that you see on the news every night on national news. One of the things that is very clear is that we have an older population that is a little more vulnerable in terms of our teaching, in the ranks of our teachers. And so this is an additional reason that it's really important that we get it right. Yeah. Thank you.